Hey everyone, in this video, I will be talking about why I chose the emergency department over the intensive care unit. My goal is to provide some insight on the differences so that you can make an informed decision based on what you like. In this channel, I aim to provide more information about the nursing profession and share my nursing knowledge to help others. If that interests you, please consider subscribing and giving this video a thumbs up. I would greatly appreciate that. When I was a bedside nurse on a floor, I did not know too much about the differences between emergency nursing or intensive care nursing. I tried watching different videos and research online but little information was available. So in this video, I will share what I learned and why I chose to be an emergency room nurse rather than an intensive care unit nurse. This is especially important in British Columbia, the province I work in, because you can get the hospital to pay for one specialty program every 10 years. So essentially, if you choose ICU, you must be an ICU nurse for 10 years or pay out of pocket to switch. It also means that you owe at least 16 months of working in that specialty. Now that I have stressed the importance of making the right decision, let's talk about the reasons why I chose the emergency room over the intensive care unit. Number 1, diversity of patient care experiences. Most ERs have multiple different departments such as first aid, intake, fast track, trauma, acute, etc., which means that the patients you have to know how to serve can range from neonates to elderly adults. Therefore, this variety and the fact that you have to be versatile made me intrigued to choose ER nursing versus ICU, which has a specific set of demographics that they generally serve. Number 2, better for my future career prospect of being an NP. Now, this is obviously debatable, but being so versatile, you learn so much about so many things that it will definitely prepare you to be an NP. As I said, there is even urgent care clinic section of the ER, which is great because that is the demographic you will typically serve as an NP. However, if I was to be a CRNA, ICU would definitely be the way to go as you get more experience titrating drips and monitoring hemodynamics. But that is not to say that you can't do that in the ER, as certain hospitals have trauma sections which may be required to monitor and manage an ICU patient for prolonged periods of time due to lack of beds available. This is especially evident more than ever during a pandemic. Number 3, there is level of camaraderie that is unparalleled to other floors. You have to be able to work well in teams, and that to me is so much fun. Working alongside nurses, physicians, pharmacists, lab tech, ECG techs, and many more make the job so rewarding as you are providing one part of a person's care, ultimately helping them leave the hospital. The ER is so unpredictable, so there are times where people can take a turn for the worse and ultimately require a lot more support from staff right away, and I feel that as an ER nurse, it is your job to identify that. However, in ICU, it is more standardized in their environment as they have certain protocols for typical things that occur. Not to say that it is easy by any means, it is just less chaotic as there are more certainty with a person's condition than the ER. Number 4, more interactions with patients. Communication is an art form in itself, and being vented and sedated is part of an ICU nurse's job. This is quite challenging to therapeutically achieve, but at the same time, it takes away from certain aspects of care that you are not exposed to as an ICU nurse. That is something that did not interest me, which is another reason why I chose the ER. Overall, being either one would be incredibly rewarding career field. Both have extremely challenging work conditions, which is why it is typically known to be a critical care specialty. I hope that this video provides you with some insight, and I would love to hear what your thoughts are on this matter below. Thanks for watching, and we'll catch you in the next one.